EUS-guided pseudocyst drainage through gastric pouch using lumen-apposing metal stent in a patient with Roux-en-Y anatomy. A 39-year-old female with a history of Roux-en-Y gastric bypass and idiopathic recurrent acute pancreatitis was admitted with refractory nausea, vomiting, and early satiety. CT scan of the abdomen revealed a 9 by 9 centimeter pseudocyst compressing the gastric pouch. After discussion with the patient, she elected to proceed with EUS-guided pseudocyst drainage using a lumen-apposing metal stent to relieve persistent symptoms. An EGD was performed, which confirmed Roux-en-Y anatomy and showed the presence of extrinsic compression in the gastric pouch. On EUS, a large pancreatic pseudocyst was seen. The cyst was punctured under endosonographic guidance using the hot axios system, and a 15 mm by 10 mm lumen-apposing metal stent was placed to create a cyst gastrostomy. This led to the drainage of copious amounts of fluid, which was aggressively suctioned. The overall technique to perform the procedure was similar to that in patients without Roux-en-Y gastric bypass. The stent was seen to be in satisfactory position at the conclusion of the endoscopic examination, and there were no post-procedure complications. The patient reported a marked improvement in symptoms following the procedure and was discharged. A follow-up CT scan 2 months later showed near complete resolution of the pseudocyst. The lumen-apposing metal stent was later removed uneventfully during a follow-up endoscopy, and the patient continues to remain asymptomatic. In conclusion, EUS-guided pseudocyst drainage using lumen-apposing metal stents can be safely performed in patients with Roux-en-Y anatomy and is effective at providing symptomatic relief.
This case discusses EUS-guided drainage of a pseudocyst via a gastric pouch was successfully performed using a lumen-apposing metal stent in a patient with Roux-en-Y surgical anatomy. This approach is particularly beneficial in managing complications associated with pancreatic pseudocysts, especially in patients with altered gastrointestinal anatomy. The use of endoscopic ultrasound, EUS. It allows for precise localization and access to the pseudocyst, minimizing the risk of complications. The lumen-apposing metal stent facilitates effective drainage by creating a stable connection between the cyst and the gastric pouch, promoting fluid removal and resolution of symptoms. This case highlights the efficacy of EUS-guided interventions in complex anatomical situations, demonstrating that advanced endoscopic techniques can provide significant therapeutic options for patients with challenging conditions. The successful application of this method underscores the importance of tailored approaches in managing pancreatic pseudocysts. Thank you for watching. Subscribe if it is useful.